A lump was found, and almost 3 weeks later I had an ultrasound and was told that it was cancerous. It was a cancerous growth. It was a big blow because it was just such a shock. But I'm okay, let's get at it, let's do it, and away we went.
So generally it's similar to having an X-ray taken. You go into the room, you're positioned on the treatment table, the staff leave the room, the treatment is delivered, and the patient feels nothing.
So it is a very focused type of radiation, a very focused type of treatment. And because of that, we kind of limit the types of side effects that we get.
First, we do what's called treatment planning. And these days we have what's called a CT simulator. So we take a CT scan, then we can outline the target required, as well as the normal surrounding structures. That allows us to target the cancer and at the same time avoid treating the normal surrounding tissues.
We do have to give them some permanent markings on their skin that day that are called tattoos. And they do go on with a little needle pick. They end up looking like a little black freckle on their skin, so that when they come every day for treatment, we know that we're treating the exact same spot from day to day. We would never actually put a tattoo anywhere actually above the neck area. Patients who are having their head or neck treated actually have a mask made that's made of a mesh type material, and so marks are then placed on the mask.
I came in, changed into my gown, was pretty much taken in almost right away. It wasn't a big long wait. The whole procedure itself probably only took about 10 minutes, so I was in and out of here very quickly.
We'll be lining them up to either the tattoos or the marks on their mask. That requires us to actually physically move them. The biggest role that they're going to be playing is to actually lay nice and still for us and trying not to move. And it's probably the hardest thing that they're going to do because it's very natural for people to try to help us. We do have to leave the treatment room when we deliver the treatment. But we are watching them on cameras, and we have an intercom system.
Radiation is really very simple. It's not painful, it's not scary, there's nothing to be afraid of.
The machine is going to be moving around them. It doesn't ever touch them. It does come quite close, and the bed is quite high. It's usually about 4 or 5 feet off the floor. So it is quite important that they do lay very still and not move.
The noise from the machine is not invasive at all. The confines of the machine, there's a distance around so that you can still breathe and see and think.
After a few weeks, the patient may start to experience some side effects, and towards the end of the treatment, often a patient may feel a bit tired.
Skin reaction is also fairly common for all of our patients, and they may notice that their skin gets a bit pink, it gets dry and itchy. It doesn't start right away. All of these side effects kind of start gradually into their second week, third week kind of thing, as the radiation kind of starts to build.
If you are defeated and down, and it's not a good place to be because it does not help you heal. A positive outlook is everything.